Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. Welcome to episode 338 of the podcast for April 2nd, 2019. My guest today is Mr. Dube. He's the Chief Executive Officer at Leratong Hospital. He has over 40 years experience in the public service, including time as CEO at the hospital since 2005. Leratong Hospital is an 855-bed regional hospital with over 1,700 staff members. It's located just east of Johannesburg, South Africa. So Gray is the third consecutive hospital CEO that I've had as a guest on the podcast. That goes back to Gladys Bogoshi, also from South Africa in episode 336, and Vance Jackson from West Virginia in episode 337. I think it's really interesting to hear similar philosophies and mindsets from these different leaders. Like Gladys, Gray is going to be a keynote speaker at this year's Lean Healthcare Transformation Summit to be held in Washington, D.C., June 13th and 14th. I'll be there, and I hope you can join us. I'll also be teaching a pre-summit workshop on my book, Measures of Success, and I hope you can come join us. If you'd like to learn more about the summit and links to all of this, you can go to leanblog.org/338. So in this episode, Gray and I talk about how he got introduced to Lean and how he leads the Lean transformation efforts at his hospital, including assessing and modeling his own behaviors, including humility and self-discipline. We'll talk about how he's working to change the culture to one where all people are trained to be scientific problem solvers. And Gray shares about that, some of their success stories, some of their challenges, and more in this conversation. Thanks for listening. Well, again, we are joined today by Mr. Gray Dube. Gray, how are you today?
Okay, I can hear you very well.
Well, thank you. Thank you for joining us. And really excited to get a bit of a preview of some of the story that you're going to tell at the summit in June. But I was wondering if you could first, introduce yourself to the listeners and talk a little bit about your career in hospital management.
Okay, yeah. I'm Gray Dube, the CEO of Leratong Hospital in South Africa. I've been a manager in a hospital environment for about 44 years. But I became a CEO for about 12 years. And since then, I've been doing various projects. And we are running a regional hospital, which is about 855 beds. And obviously, every month we see around 25,000 patients. And out of those, 4,000 are admitted in our environment. And against this background, clearly we need to be working very hard to ensure that we've got systems and things that will ensure that we use our money efficiently as to improve our patient care. And then I started my career as an administrator around 1973. And then since then, I've been around the health environment, moving from one position to the other until I became a CEO around 12 years ago. And since then, I've been in this hospital for about 12 years, yeah.
Okay. And when and how did you first get introduced to the idea, the concepts of Lean?
Yeah, I think in 2014, I think Professor Norman Fall of the Institute of Lean SA came to do a presentation to us in 2014. And then around 2015, he came to Leratong Hospital and did a rapid improvement around the three areas, which is pharmacy, MOPD, and patient registration. And then since 2015, we saw that this Lean is really working, because clearly we had a long waiting time in patient registration of about 120 minutes. And then after we have introduced the Lean concept, we reduced to about 30 minutes. I mean, almost, killing the 90 minutes that is where we started. And then since then in 2016, then Professor Norman introduced us to Dr. Dawn Toussaint in Wisconsin. I think we visited Wisconsin in 2017, where we were taught by Dr. Dawn Toussaint and his team for about 2 weeks. By then they were called TIDA-Care. Now they are called Catalysts. After that, then I think in 2017, Dr. Toussaint came to South Africa for the Lean Summit. And then he came to visit our institution. Then he saw what we have implemented. And then he decided to mentor us, myself and Ms. Bogoshi from Charlotte Macleke, on those about 12 areas, which is one of them was about fundamental behaviors and those scientific thinking. And for a whole 12 months, he mentored us. And then on 2018, he continued with Kim Barnes, teaching us the business performance systems, which we are implementing in the neonatal ward and obstetrics department. And based on the learnings of those business performance systems, we've seen some good results in our neonatal mortality, which has dropped to about 50% for 2018. And then also the maternal deaths also dropped. That was a good result for 2018. And since then we've been learning these business performance systems, and we are seeing good results. And also in terms of the culture change, these learnings from TIDA-Care, they also help us to concentrate on the fundamental behaviors, which helped us to change the culture of how we manage. Because the culture before was command and control and micromanaging. Now, since we learned this Lean journey through Lean SA and the catalysis model from Dr. Dawn Toussaint, now we are on the teaching, mentoring, support, remove barriers, and give tools of trade. Mm-hmm. And most of the time we'll be having scheduled leader standard work, which we observe and go into the Gemba almost 3 times a week, and we monitor the time that we spend at the Gemba teaching, mentoring, coaching, removing barriers. And as a result, the motivation for staff now have changed, because they now realize that now our goal was to train them to be problem solvers, not the other way around, where we're supposed to be commanding and control and micromanaging. So things have since improved, because now we are teaching, coaching, mentoring, and providing tools of trade. And also the staff is learning the new way of doing things, the standardized business processes. Before, we didn't have standardized business processes like A3 thinking, visual board, fundamental behaviors, leader standard work. So we didn't have those such things. Now we have those tools. Now things are starting to show the results.
Well, that's great. And it sounds like there are a lot of great results and benefits that you've seen. So, I think I have a number of follow-up questions to maybe dig a little bit more deeply into some of the great points that you raised here. So I was curious if you could talk more about culture and experiences, either personally or in coaching others. It can be difficult to change behavior, especially when, as individuals, we might have a long history of being encouraged to operate a certain way, like you said, around command and control and micromanaging. So I was wondering if you could share some thoughts on how this individual personal change happens. How do you help open people's eyes that command and control is not the best way to run an organization?
Yes, I think what first we did, we had to sit with the team and do an exercise on the fundamental behaviors that we were taught, which has willingness, humility, curiosity, perseverance, and self-discipline. So those fundamental behaviors, one had to sit with leadership, his managers, ESCOM members, and say, let's rate ourselves around these senior fundamental behaviors. And then some of us rated us 2 in self-discipline, others rated themselves in 1 in humility and curiosity. Then based on the results of those fundamental behaviors rating, then one started to see the lowest point. For me, my lowest point was self-discipline, because I didn't have leader standard work, which I was disrupting my staff more often, because now I didn't have standardized way of doing things. Now I had to spend around 12 months to try and develop that culture. And my culture change also cascaded to the level that I'm supervising. And it went down to them as well, because some of them rated themselves by 2 in humility, and they start working on those lowest points. And then we started going to the areas where value is created for patients. And our approach now was trying to adjust our culture to the one of mentoring, coaching, go and see, listen, and probably ask open-ended questions. Like when you go to the Gemba, then you say you are here to observe the great work that you people are doing. And then probably can you share with me your biggest challenge that you are trying to manage today? And then the people share with you and say to them, okay, fine, where do you need my support? Where can I help? Where can I remove barriers? Now people started opening up, because now of that approach. And then we also had to have buddies, people that will monitor whether, when I say I need to change, and have my visual board and the culture of going to the Gemba, asking humbly inquiry questions. And then somebody will give me, the body will give me feedback to say, but today it's like you're not, okay, you're commanding and control, but please change this one and then go to ask better questions and also be polite and humble. So we started practicing those, and people now have seen that the approach from management now it was one of going to the front line and learn instead of going there and tell people what to do. So they started accepting, how management now is doing things. And then they also saw where we have modeled the link. They have seen now people will start now enjoying, management presence. Like before, they were not enjoying management presence in their
right.
Yeah,
and I think that's a really common progression that an organization makes. Can you talk about some of the process of trying to help? It seems to me that it takes time to build trust, where people can learn to view it as a positive when management or leaders are there. Could you talk a little bit more about that and some of those, some of the interactions you're having now, and a little bit about that process of trying to communicate and build trust?
Okay, no. So what we normally do, I'll probably inform the like, for example, if I want to go and visit the new needs ward, which is the ward where the new needs are managed. One will give an appointment to say, I'll be coming to see you tomorrow, and then these are the questions that I'll be coming to ask you in terms of the humble inquiry approach. And then I'm not going there to come and catch you. I'm coming there to come and support you and see how you do your things. And then people will start now believing, because now you are showing that by acting. You go there space and talk to them. Though some more people will be reluctant to believe what you are saying, but when they see you modeling that behavior, they start to respond positively, because now they see from you as a leader that now you are modeling the behavior, of humility, go and see, support, and then they start now to follow you because now they see it's not just a cheap talk. You are really modeling it.
Yeah. And it sounds like modeling that behavior starts with you as the CEO, right?
Yes, yes. And then when then it goes to my next level, and then it will go to the next level because they see now that definitely this is how management of the hospital, act and behave and support. So, and now these areas where I think we've got areas that we have implemented this lean journey, and now because of that result that they see from those areas, now other departments have already started, they are small projects. Even if we have not started formally the lean, but they are now using the data sheets to communicate. The data sheet is the sheet that talks to 8 standardized questions around safety, quality, customer, and they started implementing those now. They are doing things in a standardized format. Yeah.
Mm-hmm. So one of the behaviors you mentioned earlier around self-discipline and leader standard work, can you share a little bit more about what that means to you as a CEO? What does your leader standard work comprise of, and how does that guide what you're doing in a typical day?
Yeah, I think my leader standard work as a CEO, it comprises of various activities. I think there will be meetings in that leader standard work. There will be schedules for reviews of staff, and there will be schedules of visits to various departments, and there will also be schedules of one-to-one meetings with various managers. And also there will be a schedule for me going out to other meetings to meet other CEOs outside the hospital. And there will also in that schedule, we'll also have a schedule where I will go and meet with my principals, like for example, in our case, is the politicians that we report to. Everything is compiled in one document, which is called, which I call it a schedule for the year, the calendar standard work. So, and I try my best to follow that calendar at all times. If I have to do reviews, I'll make sure that I honor those dates and those times. And then if I'm interrupted on that calendar schedule, then I'll record my interruptions and able to prove to anyone that these are the days that I was interrupted. I couldn't do my Gemba walks because I was interrupted by X, Y, Z, or whatever. Yeah.
Mm-hmm. So there's some opportunity for continuous improvement to try to prevent some of those interruptions, or at least to know why they're occurring.
Yeah, because now once you know why they're occurring, then you can be able to engage on those and try and then design an improvement plan around those interruptions.
Yeah, because in Lean, of course, we talk about studying how the work is done and identifying waste and improving. And as a leader, it sounds like you find opportunities to try to reduce waste so that you can focus on the most important things, right?
Yes, because now as a leader, if your time is not monitored, obviously you will be contributing to the waste. And also, if you are a leader not organized in terms of leader standard work, you will disrupt the whole system. Like, for example, you call your meetings anytime, which is not scheduled, and you disrupt the whole management team and the system. So one of the things that is in my leader standard is no meeting zone. Like, for example, between 8 and 10, my leadership will not engage in meetings. They will be at the front line doing, supporting, teaching, mentoring. And as a result of that, it has also reduced firefighting, like example, getting things all of a sudden to you. Yeah.
So one other thing I was hoping you could tell us more about. You mentioned earlier the idea of Lean as scientific thinking and training people to become better problem solvers. I was wondering if you could either share some examples or talk about how you're helping people understand that and make connections to scientific practices in medicine.
Well, I think in terms of the nurses and doctors that we have here, what we do, we normally put the people on the what we call the rapid improvement week. So if we want to implement a project, like for example, if we want to do a project in pharmacy, we'll go to pharmacy. Before we go to pharmacy, we'll call them the managers and the team of that department and put them on a 2-day lean workshop. And then from the 2-day lean workshop, where we teach them the tools of A3 thinking, visual management, A3 thinking. And then once they understand the tools, then we can visit the department and do what we call rapid improvement, where now the team in that department, whether you're a doctor or a pharmacist, then you'll form part of trying to find a solution for your own department if it's pharmacy. If the challenge was the long waiting time, then basically it means all of us for that rapid week will be finding ways of trying to reduce the waiting time. And everyone will be involved now in terms of doing the assessment, doing the research, gathering data, and then after that, the second day will be to analyze the data and try and see where are the room for improvement. And then after 5 days, probably people now will understand. Then we will start plugging the process, the steps that causes the delay, and then out of those steps, what we can reduce or take out, what we call value stream mapping. So we'll do that value stream mapping, and then out of that, then we'll deselect and remove the steps that are not adding value. And then after the 5 days is done, then people will be mentored. We go into the department and check their A3s, check their value stream mapping, and then on a weekly basis, then the patients will be tracked if it was taking waiting time. And then, that is how we push people to understand how this thing works, because we are coaching them at the same time solving the problem. Yeah.
Who leads the rapid improvement weeks, the rapid improvement activity when you do that?
Yeah, I think we've got it. We have trained few people that we call lean coordinators. I think the lean coordinators, we've got like we will select people from the department, like the frontliners will have we call them lean coordinators. Then these lean coordinators, they will be a person from that department where improvement is going to happen. And then they will be supported by one of our provincial lean coordinator, which is Oki Matipa, will be coming, and then also I'll be coming in also to go there and teach with their line managers, because I've been trained for about 4 years, so I'm on this lean journey for about 4 years, so I can teach some of those tools. Yeah.
And let's see. I was also going to ask, what are some? You've talked about some of the improvements that you've already seen: reduced waiting times, reduced mortality. What are some of your goals here for 2019? What are the goals for your hospital, and how do you hope that lean is going to contribute to reaching those goals this year and even into next year and beyond?
Yeah, I think our goal now is to expand the lean model lines, one to theater, because we want to target orthopedic theater. Because now we have realized that some of the management of the organization, they sometimes lacking. And also one of the things that we also want to push for 2019 is to reduce the maternal death and the neonatal death, and reduce infection in the neonatal unit. Infections such as Klebsiella. Klebsiella is some bug that attacks neonates. So we're working very hard on that. It's one of our priorities. And then also in terms of making sure that we maintain and reduce the waiting times in those areas that we already started. and also eliminating waste and try and to improve staff morale. So that is what we are trying to plan for this 2019. But at the same time, we're also trying to spread the lean journey to other hospitals. By the target is to train about 6 hospitals in 2019 that are not that are aside to the Western District in Gauteng. And then we're also going to train some leadership in our head office there to try and also understand the lean concept. So to date, we've already trained about over 200 people now on this lean journey. That we need to spread it to other hospitals as well, because they've seen the good results here. Now they are also coming to be taught how to spread in their own areas as well.
Yeah, and I've also interviewed another hospital CEO that you know from Johannesburg, Gladys Bogoshi, who's also going to be presenting at the summit. Do you find opportunities to work with Gladys and share practices across your hospitals? Do you try to help each other out as people who are becoming lean leaders?
Yes, we really support very much one another in many areas. Like, for example, first we have a teleconference that we normally discuss on a weekly basis, discussing about the challenges that we meet as hospitals. And for example, if I want to do something around the hand washing, we normally share experiences around hand washing and also in terms of training and development of staff. Because sometimes I went to a hospital to go and present to a manager around these fundamental behaviors. And then also she was here when Kim and Vanna was here just to see what we have done and also learning from what we have implemented. And also in terms of doing a visual board, CEO's visual board, we support one another in terms of doing the CEO visual board and the keeping of records. And also, because he's an academic hospital, I'm a regional hospital. And then we also support one another in terms of transferring patients that we cannot manage at this level to his hospital. And I'm helping the district hospital that transfer patients to us. So we communicate quite a lot. I think every week we communicate. Even yesterday we were talking about how are we going to take this lean forward to all the other hospitals in Gauteng. We're discussing that yesterday. So we're planning on something to spread this journey to other hospitals as well. And yeah.
So you've learned from people like Norman Fall and John Toussaint and Kim Barnes, and now you're in a situation, position where you can teach others. So let's just imagine for a second that you meet another hospital CEO who doesn't know anything about lean. How would you explain lean from one CEO to another?
Yeah, what we do, because now sometimes people, when you talk, they're sometimes reluctant to accept what you are saying. So what we do is we invite them to say, can you come and visit and join me in my Gemba? So when they come, then I will take them, for example, to casualty. I will take them to pharmacy. I will take them to neonatal ward. I will take them to my board where I've linked the true notes to the activities that are in the units. So once they see the board, then I start teaching them about lean. I normally give them about 4 hours presentations with their managers. So on lean now, the tools of lean, the visual management, 8 types of waste. So, but they have to see first the results. Once they've seen the results of lean, now they are getting motivated to start it. Because most of them now we are flooded with calls to say, no, I need to start. Because they came and saw what we have been done already. Because sometimes when you take people, you want to teach them, without them seeing the outcome of it, they believe, they are reluctant to accept what you are saying. But once you say, come and see what we have done, and then you can decide from there. And most of them have accepted once they've seen.
Yeah, and so that's I appreciate the way you answered that. Instead of just talking about lean, you want to take them to go and see that would be a more effective way to really understand, or at least start understanding what lean is about, right?
But yeah. And then I think most of them they've started now. Lean. I think as we speak now, they've started around this for this year only. We've started at about 3 hospitals. Yeah.
Mm-hmm.
Yeah. And then our lean coordinator, which is Oki Matipa for the province, is now in one of the hospitals in Telemohorani doing a rapid improvement in their casualty with them.
Yeah.
So I think next week on the 19th, I will be in one of our hospitals, which is called Beki Mlange, a district hospital. I will be teaching there the fundamental behaviors, and how they should see lean in terms of the culture change. Because if the leadership is not leading by showing that behavior that has changed, then the team at the bottom, they sometimes reluctant to follow.
Yeah. But boy, a lot of these changes are easier said than done. I'm curious if you can think about situations where lean has been a challenge, if people have disagreed with the approach, or if they've been skeptical about lean. How would you continue that conversation with somebody?
Yeah, I think sometimes when you start that, you will find difficult individuals in any work environment. Those who are really doubting whether these things work or not, because they are so ingrained in their old habits. Now, what we normally do, we probably avoid an argument with those people and try and concentrate with the people that are willing to change. Once you spend more time with the willing people, the unwilling people now will see the results of those who are starting, and then they will automatically fall in. But because if you spend more time trying to convince people who are unwilling, then probably for me, I see it as a waste, because most of then in the same department, you'll find that out of 20 nurses that you have, maybe you'll find about 3 of them are just probably not keen to continue, but you will just focus more time and weight on the people that are willing to learn this new model. Yeah. And then once they see the results, then they come in, without being called. That is what I've seen when I was practicing this lean. And then, for example, in other hospitals that we're doing, some of them collapsed completely on this lean journey because the leadership was not really showing support and the behavior that links to the lean. Because the fundamental behavior and the tools, they go hand in hand. But first, the behavior is the one that must be focused on, and the challenges of people that are really doubting, that are not, we avoid spending time with them arguing and whatever. We just try and show the results, and then out of the results, people will just follow in.
Yeah. So, what are there other key themes that you plan on talking about at the Lean Healthcare Transformation Summit in June?
Yeah, I think the one of the things that we want to share with them is that we wanted to show them that the leadership behavior can make or break the institution. One person can just break and not and stifle progress, but we want to share with them that this change of behavior is the foundation of the lean transformation, lean tools. So if you spend more time ensuring that you mold your behavior to be that of support, go and see, remove barriers, and self-discipline and effective listening, then we want to share around that to say how it has helped us to improve and change the culture of the institution.
Mm-hmm. Well, that's great. Well, I'm looking forward to your talk. Looking forward to meeting you at the summit, and I hope some of the listeners will be able to come and join us. When you're coming to the U.S., do you have any opportunities to go and see at some different hospitals while you're here?
Well, yes, we requested the region whether if he can make that opportunity for us. We are prepared to go and see. Yeah, the organizer of the summit, we asked her to allow us time to go and see other hospitals there, how they are doing it. Well, she said she will see how she can fit us in that program.
Yeah. Okay. Well, I hope that ends up working out for you, and maybe somebody who's listening, who's in the Washington, D.C. area can volunteer an opportunity for you to go do that. And I appreciate the interest that you have in continuing to learn and continuing to practice what you're doing here. But I want to ask one other question. I saw on the Lean South Africa website, you were asked, or in the Planet Lean website, Rose Heathcote from the Lean Institute Africa asked a very interesting question. So I'm going to also ask it for the listeners. You mentioned 44 years in your career. It's not that I'm asking you to retire, but at some point you will retire. And what have you done in terms of planning to help make sure that Lean continues after you retire?
Yes, what I've done, I've trained the people that report to me, few medical managers, the people that supervise the doctors, and I also trained few nursing managers, which are young, and also I've trained few people, and then also I've put a system that every week all those departments that are having are implementing Lean, they need to report on the executive meeting the progress of their Lean week to see how far did they go, and as now I'm just on the retirement age. These guys now they are chairing meetings. I'm just sitting in a meeting, observing them how they do things, and then maybe commenting there and there. But now at this stage, I'm slowing down. I'm pushing them to make sure that they continue this Lean journey in the hospital, whilst I'm prepared to be teaching the others now after my retirement.
Mm-hmm.
Yeah.
You can continue continue teaching others the way John Toussaint has after he stepped down as CEO at the Theta Care Health System.
Yeah, so I'll be sharing the stuff with the people now in Gauteng province, not necessarily Leratong Hospital. I'll be sharing the whole Lean journey. As Dr. Toussaint has said to us, please spread the journey. So we're spreading the weight, and I don't think it will collapse. It will continue.
Yeah, well, I hope so, and planning for that sustainment and succession planning is certainly a very important thing to focus on. So, Gray, as we wrap up here, is there anything else that you wanted to share with the audience? Advice about Lean, advice about leadership, either in the context of Lean or your long accomplished career in general?
Yeah, I think for me the experience that I need to share with them is that if you are a leader of any organization, you need to make sure that you really humble yourself in front of your team, and make sure that you really listen, and make sure that you support, teach them, and remove barriers. I mean, and making sure that, for example, if a nurse is frustrated by the doctor who's always starting late, I mean, your leadership is to make sure that you go there and assist the nurse, remove that barrier, and also the thing that leaders also must avoid is to try and not have that superiority complex. Superiority complex, like, don't think you are above the others. You must just try and fit yourself and try and be on the same level with your team. Don't try and show your bossiness and try and roughshod the team unnecessarily.
Yeah.
And then also you must show that culture. You need to show that you care for your staff as well, and reward them when they do good, and compliment them. Don't try to be knowing it all. I mean, you must not be know it all. You must be a learner in most of the cases, because people at the front line, those are the people who knows how best to do the job, and you must respect them. That's advice that I want to give to people here.
Yeah. Well, it's great advice. Yeah. Well, it's great advice, and really appreciate you sharing your reflections, Gray. And again, I'll invite listeners to come to the Lean Healthcare Transformation Summit. It's going to be in Washington, D.C. this June. I'll put a link to the more information about the summit and registration in the show notes for this episode. You can also do a Google search. Just check out through Catalysis. I guess you can also go to createvalue.org, which is their website. So again, we've been joined today by Gray Dube. Gray, thank you so much for making this. I apologize for the interruption to your Leader Standard work, but thank you for taking the time to share with us today.
No, thank you very much, Graham, for really talking to us. Much appreciated. Stay blessed.
All right. Well, thank you. We'll looking forward to meeting you soon.
Thanks for listening. This has been the Lean Blog Podcast. For Lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.